This conversation marks the 10th in our series of press briefings on the economic and business impact of COVID-19. And today's conversation will focus on the various state responses to the pandemic, as well as what we might expect moving forward as state governments work with the federal government to fund continued relief. I'm going to hand things over to our panelists here shortly, but I just want to provide a quick overview of how today's conversation will go. Each of our experts is going to share a few minutes of insights in succession during the first half of our conversation. We'll then spend the second half of today's conversation answering your questions. So for reporters who are joining us via webinar, you are welcome to submit your questions anytime. If you could just include your name, your title, and your affiliation when you do so, that would be fantastic. And you can use that Q&A function right there at the bottom of your screen to submit those questions. For reporters who are joining us by phone, you are welcome to submit your questions to me via email. My email address, as a reminder, is mackenzie_bad@kenan-flagler.unc.edu. With that, it is my pleasure to hand things over to today's first panelist, my colleague, CREATE Director, Professor Maryann Feldman. Maryann?
So it's my pleasure to be talking to you today. And so at UNC, I'm a professor of public policy and also a professor in the finance department at Kenan-Flagler Business School. And I've been very interested in following the state responses to COVID-19 and really trying to make sense of these various responses. I have found it instructive to reread the Federalist Papers. And the Federalist Papers discuss the division of responsibility between state and federal governments. And it is Madison who argues that the purpose for government is to provide for the happiness of citizens. And that's a quaint word for us to use now, but I think it's instructive in this time of crisis to keep that in mind. In Federalist Paper 45, Madison argues that state governments are closer to the people and can best focus on their welfare regarding affairs such as pertaining to lives, liberty, and property, and as well as to the internal order of the state. And so if we look at the time progression, what we see is that the first confirmed case of COVID-19 was reported on January 21st. And the outbreak sort of continued at a very slow pace through February and then accelerated rapidly. And February 26th was the first reports of cases with no recent travel or no direct contact to known cases. And this was really the signal that there was pandemic spread in the United States. And so interestingly, the state governors immediately sprung into action. And we have been following and tracking these data. And we find from March 6th until May 11th, there were 785 executive actions within the 50 states. And each of the 50 states has been involved. Now, it's interesting to note that right now there are 26 Republican governors and 24 Democratic governors. And this story is frequently interpreted as a red state, blue state divide, but the evidence suggests that regardless of political affiliation, governors have been involved in executive actions across a variety of topics. And so, all the governors have really responded to funding for medical needs. And this is about half of the executive actions that we found. These are things like mandating no out-of-pocket payments for COVID-19 testing or eliminating needs for co-payments. Other actions include deploying the National Guard to assist healthcare professionals and expand healthcare capacity. Also limiting public gatherings, and then really just trying to increase hospital resources and capacity. Another third of the governor's executive actions have been directed at shoring up this safety net and responding to the direct needs of citizens. And these include actions that limit mortgage foreclosures and evictions, that limit utility disconnections, and that try to address food insecurity. There have also been many efforts to relax unemployment criteria. And so we've all heard about the problems that states have had with their unemployment insurance systems. And there's a recognition that the delays for the 30 million people who suddenly applied for unemployment was due to the fact that, first of all, states rely on legacy computer systems that were designed primarily to prevent waste, fraud, and abuse, and not to respond to this type of immediate crisis. We also found that there's a difference in that governors also set up task force. These task force are guiding some of the reopening actions. Republican governors were more likely to do this within their state, while Democratic governors formed multi-state task force. And let me mention that as we look at this, the incidence of these executive actions, we see that these peaked in advance of the issuance of a stay-at-home order. And that seems to indicate that governors were trying to use other things to address the crisis, and that the stay-at-home orders were a last resort. Let me mention that rather than political affiliation, governors' responses seem to be dictated by the election cycle. Governors who were up for re-election were more active within the first 2 weeks of March, but states overall with an open election, that is where the current governor is not up for re-election, implemented more executive actions on average. And this indicates that the pressures of an upcoming election may have affected the latitude that governors felt that they could respond. And this is just a simple story, observations, but I think that the story is much more complicated. And the red state, blue state narrative that we hear is certainly naive and divisive. What's much more important is population density and demography, with states with older and sicker populations being more adversely affected. And probably as we see that there is great inequality that the COVID-19 crisis has exposed. And so there are certain actions that governors have taken to be more forward-looking. And Governor Whitmer from Michigan has introduced what is essentially a GI Bill for COVID-19 frontline workers. It would provide free college tuition. We're not seeing very many of these forward-looking actions because of the state budgetary crisis. Now, it's too early to tell how these executive actions are going to address business needs and how they're going to impact the long-term recovery. And this is a topic that my colleague Eric Ghysels will talk about.
So I'd like to talk a little bit about budget situation in the States. And maybe I'll start with some key numbers. About $1 trillion across all states is spent on education, but also $1 trillion on social services and healthcare, and a little bit more, $1.1 trillion on public safety and pension funds. Now, some very preliminary figures paint a rather grim picture of what is to come in terms of state budget situations. These are very preliminary releases by the Urban Institute on tax revenues year to year, April 2019 to 20. And again, these are very noisy because tax collection data takes a while, more than a year, to actually get final data. But they show, for what's they're worth, about 5 states with more than 50% reductions in tax revenues. And referring to what Maryann was talking about, this is not a red versus blue kind of narrative again, because 3 of the 5 have Republican governors. Massachusetts, Missouri, and Montana, and the other two are Pennsylvania and Kansas. The state of North Carolina fares in comparison reasonably well, in the sense it's only a 12% decline for those numbers. I've also worked more on model-based predictions, real-time predictions, which take advantage of economic activity throughout the fiscal year. This is joint work with two of my former graduate students. One is now on the faculty at Indiana University Business School, and the other one is with Amazon Web Services. We find that in terms of predictions for Q3, Q4, moving forward for 2020, depending on the scenarios, in terms of how deep the recession will be, how quickly we will recover, we're talking about 5 to 10% drops in revenue for most of the states. There's a fair amount of heterogeneity, and that's because of the tax base that is very uneven across the states. In fact, overall, it's about 1/3 is based on sales tax, 1/3 is based on property taxes, 20% roughly on personal income tax, state taxes, and then the rest is motor vehicle, alcohol sales, etc. Now, there are actually a number of states without income tax, so they rely quite heavily on sales tax. In fact, some of them more than 50%. That includes Florida, that includes South Dakota, etc. Texas is pretty close as well. And you could sort of see that that's actually also prompting the governors to think about lockdowns and opening their states early, because their revenues are more sensitive to the sales tax as the source of revenue. It should also be noted that almost all states have balanced budget requirements, so that when you're seeing a drop in revenue, it will have to have an impact on what's also the spending of those states. In this particular difficult times, that's going to be a challenge. The balanced budget requirements are somewhat uneven across states, so some states have more flexibility than others. Now, let me sort of spend the rest of my time talking a little bit about quote-unquote solutions, what sort of can be done. I guess there's one, which is to borrow, and I'll talk a little bit about the municipal bond market. The other one is to have federal assistance, and that's been a little bit politically charged with the discussions that have taken place between the Senate and the House plans. And then there is tax increases and spending cuts. So let me start with the municipal bond market. The municipal bond market is about $4 trillion compared, so this is the market where state and local governments issue bonds. In comparison to the federal debt market, which is now $25 trillion, it is a much smaller market. A lot of these bonds are held by individuals because people tend to buy municipal bonds for their tax advantages. Defaults are extremely rare in this market. According to Bloomberg, the default risk for an investment-grade municipal bond is about 0.18% over a 10-year period, whereas a corporate bond of same investment grade is 1.8%. So it's about 10-to-1 ratio of default risk. There have been some rare defaults. The city of Detroit, Stockton, California, Jefferson County in Alabama, Puerto Rico. They're messy, but they have happened. And so Mitch McConnell has sort of suggested that bankruptcy or default might be an option, but that is not going to be a very easy solution, actually. The second one is federal aid, and the House just passed a bill which has about $1 trillion in terms of aid for the state and local governments. there we have a discussion about the transfer, essentially, of debt to the federal government. The federal government has, since the beginning of the Trump administration, even before COVID, increased the federal debt by about $3 trillion. Add another $2 trillion to this during this current pandemic. The CBOE sort of expects that we will have about a 101% ratio of debt to GDP by the end of 2020, and we will surpass the historical level of 106% in sometime in 2021. Historical level meaning right after World War II, the U.S. was indebted as well. This, nevertheless, being said, the federal government can borrow much cheaper than the states. And in fact, real interest rates are still negative. And so some transfer does make sense, actually. Last but not least, if we sort of go back to the Great Recession, the fallout of the financial crisis, 2008 and 2009, most states also faced budgetary constraints, although they were not as severe as the ones that we are probably going to face now, that we are facing now. Most states, in fact, 40 states increased state taxes one way or another, and most states, depending on what the sort of composition, it cut K-12 education, university funding, employee compensations, support for the elderly and disabled. So we will ultimately see a mixture of borrowing, perhaps some federal aid, tax increases, and cuts in services. Those are actually political decisions. And so I'm going to pass on to my colleague, Chris Clark, who will deal with the policy side of all this. Thank you.
Hi, everyone. My name is Christopher Clark. I'm on faculty in political science here at UNC-Chapel Hill. I study state legislatures, and actually a lot of my research also looks at identity politics, race, gender, and so on. Although I'm not going to talk as much about that, I'm going to focus more on state legislatures as an institution. And so thank you, Eric, for your words and really interesting things you brought up, and you as well, Maryann. So what I want to do is first of all, I want to talk a little bit about party control, okay? And again, the focus of my talk, brief conversation here, will be on state legislatures. And so according to the National Conference of State Legislatures, as of May 6th of this year, 24 states have enacted budget legislation in response to COVID-19. And so what I want to do is just talk a little bit about party control, states that have the initiative process, states that require a supermajority to pass their budget, and then talk briefly about tax and expenditure limits. And again, I want to preface my comments by the fact that I often do more sort of sophisticated modeling, regression analysis, and I have not done that here. This is more looking at descriptive statistics, and so that should be taken into account. But with that said, one of the things I want to mention here, in looking at the data, I was struck by the lack of variation of party control, in a sense of which states have one party in control of both chambers. What I mean is they hold the majority of seats in both chambers, and just about every state falls into that category. And so that's not very interesting because there's not too much variation there. So what I decided to do was next look at partisanship, and it's really interesting building upon Maryann's point in particular in terms of red states, blue states. There are 29 states that have Republican control of the legislature, and of those 29, 16 of them actually have actually enacted legislation in response to COVID-19, so 55%. And when I looked at Democratic controlled states, there are 19 of them, okay? And six of those 19 have actually enacted legislation, which is 30 score at home or wherever you are. The other two states are missing here, and one is Nebraska. It doesn't have party control, and Minnesota, there's split control. So here's the upshot, folks. What's really struck me, and again, this very cursory analysis, is that if anything, what we see is states with Republican control of the legislature are actually more inclined to pass budget legislation in regard to COVID-19, which again works contrary to this story that Republicans aren't necessarily wanting to do anything to address this crisis. And again, I feel more comfortable with a multivariate analysis before I conclude that this is like a certain point, but definitely at least at first blush, there's not a ton of evidence that Democrats are more committed than Republicans. So that's something that very much I might look into after this call and try to run some more sophisticated analyses. A few other things I'd like to highlight. Let me talk a bit about the supermajority requirement for a budget first. So what I mean by that is there are 10 states that have a higher threshold that needs to be met in order for a state to pass its budget. And the way I was thinking about this is there might be the case that if there's a higher threshold that's needed, if you need more state legislators to agree to pass a budget, then it may be more challenging to do so. Part of that might actually have to do with partisanship and polarization. And so what I did is I looked at this again from a the descriptive statistics perspective. What I found is of the 10 states that actually have this supermajority requirement, sort of in a generic way, about half of them have enacted legislation. But it turns out that there are 40 states that don't have this restriction, and about the same proportion have also enacted legislation. So there's actually not a ton there, at least at first glance. But what I then did is I dug a little deeper and I looked at variation in terms of supermajority requirements. And what I found is that there are 3 states, Illinois, Maine, and North Dakota, that require a 2/3 threshold for emergency spending. And 2 of those 3 have not yet enacted legislation. And so to me, again, and I'm much more confident in this point than I am in maybe the first point, that this rule, this constraint about what's required to pass a state budget, I think actually has some bearing, all right, at least on a subset of states in terms of why they maybe have not acted yet in terms of enacting budget legislation in response to COVID-19. So I'm really struck by this idea of the rules concerning what it takes to pass a budget mattering. Let me talk a little bit more here about rules. Or how I think about sort of rules/institutions, okay? And so the initiative process exists in 24 of the 50 states. And what I mean is citizens, we the people, can actually make public policy. There are different steps that are required and so forth. But the point is the initiative process exists in about half of the states. And so what I did is I compared the number of initiative states that have enacted budget legislation compared to non-initiative states. And I was really struck by that comparison. So of the 24 states with the initiative process, 13 of them have actually enacted legislation, so 54%. And of the non-initiative states, only 42% have enacted legislation. So what's the idea here? What do I think might be going on? In short, when states have the initiative process, it means that in future years, you might think that citizens might decide that, hey, they weren't happy with how the state legislature and the governors or state government more broadly responded to this crisis. And so they might pass an initiative that then devotes fundings to state agencies or to other entities across the state. And so I think in my mind, if I'm a state legislature with the initiative process, I want to do something first. I want to make the first move. I want to allocate resources to show that I have in fact been responsive to maybe try to dissuade a future initiative one last point here. I want to talk a little bit here about tax and expenditure limits, or TAILs. These exist as of 2015 in 28 of the states. The way I want you to think about this is simply limits on spending and our taxation in states that might in some way constrain state legislatures. And so my thought was maybe states that have these tax and expenditure limits might be less able, they may not have the flexibility to actually implement budget legislation. But that hypothesis is not really borne out by looking at the descriptive data. 46% of the states that have a TAIL have enacted legislation, whereas 50% of the states without TAILs have done that. And so in my mind, there's not a ton of evidence there that this particular institution is important. So I guess sort of the takeaway point I have here, and I'll pass, I'll here briefly here, Kody, but I often think that, and to Maryann's point, state politics is really much more complicated than we think. If anything, the party sort of variable works in a way we didn't expect in terms of Democrats being less responsive than Republicans. And in my mind, there's evidence that supermajority requirements for a budget matter, as well as states with the initiative process. And there doesn't seem to be a ton of evidence that tax and expenditure limits matter too much. So thank you for your time. Without further ado, Kody.
Hi, thank you so much, Chris. I'm glad to be part of this briefing and to join you and Dr. Ghysels and Maryann and their analysis and share an overview of how we at the North Carolina Department of Health and Human Services have responded to the COVID-19 pandemic. My name is Kody Kinsley, and I'm a Deputy Secretary at the department. And as part of our response, I've been organizing and leading our operational efforts, ranging from surging our testing and tracing capacity to ensuring that we have the right data and technology to inform our planning. Normally, and in addition to this work, I lead our state's behavioral health and IDD system, which has 10,000 staff, 2,300 patients, and a public payer infrastructure that serves over 300,000 individuals a year in the state. As this is an all-hand-on-deck situation, our department has pivoted quickly to reconfigure and put leaders into an incident command structure and align the individual capabilities with what we need to get done for North Carolina. Given the short time that we have together and the size and complexity of the COVID-19 response, I want to dive right into first the primary issues on which we have focused, which are generally shared by all states. And second, the key elements of how we're tackling those issues, along with third, how we're organizing this work here in North Carolina. I also want to highlight factors and elements that I think sets North Carolina's response and outcomes from that response apart from other states. So first, most states have been wrestling with the same issues from the beginning of this pandemic. They include providing clear guidance to the public and to key stakeholders, to acquiring and distributing sufficient personal protective equipment, planning for and implementing medical capacity to meet increased demand, increasing testing and contact tracing as part of core public health infrastructure functioning, managing outbreaks and hotspots, a lot in long-term care facilities, addressing staffing shortages as our healthcare professionals get sick themselves or need to take care of loved ones, helping to meet individuals' basic needs, such as serving children that are now out of school or supporting individuals that have lost their jobs. And most importantly, I believe, serving those that have been historically marginalized and have disproportionately felt the brunt of this disease. All of these issues have layers of nuance and context with different states facing different challenges associated with each, but effective problem identification is critical and sets the table for us to delve into what is needed to successfully tackle them. So I believe that we've seen each state leverage 4 key resources to address these issue areas. First and foremost, I believe we've seen a lot of policy flexibilities. Many of these issues require extraordinary measures to be taken in order to meet the needs of the moment, and accordingly, we have acted aggressively to create flexibilities in policies, rules, regulations that are designed to sustain and bolster services, especially healthcare services, during the COVID-19 emergency. In the healthcare space, a prime example of that is telehealth. In a matter of 10 days' time, we've advanced our telehealth policies 10 years forward. Now, some of these flexibilities are dependent upon regulatory latitude from the federal government, which I believe speaks to the element of federalism. I appreciate the reference to Madison earlier, Maryann, and we've worked to secure those flexibilities, and then where others are just within our power to grant those. But of course, now everybody's wrestling with how many of these flexibilities should remain for the long haul, how much of them should have been done in the first place, and we're thinking about that as well. I think the second key resource for all of us is data. And I think that, Chris, you made this quite clear, is that reliable and frequent information is another key input into our ability to respond to this crisis. Identifying key metrics, leveraging or perhaps building infrastructure for regular reporting, pressure testing that information, creating ways to represent and communicate the information clearly, and incorporating it into our decision making is crucial. And as I believe many have seen in North Carolina, Governor Cooper and Secretary Cohen have said many times that our approach and decisions in North Carolina are driven by science and data. And I think that tension has been pointed out around how do we lead with the public health data that's telling us to keep folks safe? How do we also be smart about it so that our mitigation efforts also allow the economy to move in a way that it can during this really unprecedented once in a century time? So of course, then that leads us to the third main resource that we've had to wrestle with, which is of course funding. Folks have spoken about this earlier. This is kind of core to what we're talking about. And it's no surprise that emergencies like a public health pandemic result in increased spending as new and existing needs skyrocket. Core value at the Department of Health and Human Services is good stewardship of resources. And in the midst of this emergency, we are holding on to that work by trying to stack federal, state, local, and other funds so that we're trying to be complementary instead of overlapping in a less optimal way. And I think that what we've seen is the federal government has made certain investments into the private sector and into government and into key public health infrastructure, wanting to make sure that we are aligning those resources in a way that drives towards the most optimal outcome, that's health first and recovery second here in North Carolina, which are deeply aligned. So securing and advocating for those resources has been a key and will remain a key element of our response. And I think finally, the fourth and most critical resource in this is really our human capital resources, and making sure that we're deploying those collaboratively, kind of aligning with the same sense of a single mission. So no one entity has control over all the tools necessary to respond to a pandemic or even any individual element of a pandemic. Accordingly, coordination among partners and stakeholders is essential to addressing any of the components I previously identified. I'll speak more specifically about some unique elements to our state that underscore this part of our response, but there are hundreds, if not thousands, of partners and stakeholders that we must work with just here in North Carolina in order to make progress. This includes other states, of course, also. North Carolina leaders not only speak frequently with our counterparts in other states, but we actively monitor their actions and leverage relevant parts of their response. It's my belief that if we can grab a best practice from another state and try to use it here, if it works within our context, that's an efficiency gain for North Carolinians. So how we go about this work, I believe, is just as important as the work itself. Every state has an emergency management and disaster infrastructure, and we also have partners across a variety of federal, state, and local agencies. This includes critical non-government partners like hospitals, other healthcare providers, trade associations, manufacturing. I think that that's an aspect of North Carolina. We've been able to make use of North Carolina's unique position of having the UNC system and a deep educational amount of expertise and the textile infrastructure that we have and manufacturing to pivot and make some of our own personal protective equipment. And that is a kind of economic and advantage position that North Carolina has that I think sets it apart from other states. Of course, North Carolina is also set apart, I think, in that it has a unique governance model. I think that every state has to collaborate with others, but North Carolina's unique political history and governance structure, which often decentralizes authority, expands the number of entities with whom we work. We have 100 counties, 85 health departments, 115 school districts, 100 county-based social service agencies, and a state governance structure where the General Assembly retains significant budget, policy, and oversight power. Many health and human service programs in North Carolina are state supervised, but county administered, meaning that the responsibility and operational control is shared. This shared governance model requires leadership by collaboration. This both helps us, but it also complicates our response. We're used to collaborating, but the scale and scope and the speed of this pandemic has required us an unprecedented response with collaborators that more so than usual. One other key contextual element is the lack of Medicaid expansion. This whole pandemic is set against the backdrop of North Carolina being a state with 1 million people, 10% of the population, that lack health insurance. To date, 37 states have expanded Medicaid, and we are among a dwindling number that have not, and accordingly do not have the tools available to most other states to respond to this pandemic. This means significant time and resources is spent in figuring out not only to get people tested, but to get them the care they need once they are tested. And if they are among the 51.5% of North Carolinians at higher risk for severe illness from COVID-19, but lack insurance, then they don't have a path towards managing their chronic illnesses in advance of getting COVID. Other states are able to provide linkages to care through emergency COVID-19 response activities that are simply unavailable to us in North Carolina. So our safety net was already stretched thin before the pandemic, added additional pressure, which makes, I think, contextually our progress in fighting the virus in North Carolina far much more notable. Many weeks into this pandemic, we've avoided a peak in COVID-19 cases and have largely smoothed out and flattened the curve. This is vital to ensuring that we don't overburden our healthcare system and specifically our hospitals with COVID-19 patients. For a state as large and diverse as North Carolina, it has been a tough task and a hard-won accomplishment. And I believe a victory to the 10 million people of the state that have carefully considered their risk and are smartly taking precautions. But this success is fragile and can be temporary. As we ease restrictions, we all must continue to adhere to the appropriate social distancing, face covering, and hand hygiene guidance that we're giving to keep one another safe. It will take all of us, each individual choice, to make this work, and we're truly in this together. This, of course, is not exhaustive, and our response continues to evolve. This very much, I believe, everyone is realizing that while in North Carolina, we're on day 68 of this response, for the context of how long this may last, it's truly the first hour, if you will, in the history of this pandemic. We have a long way to go. And we are a bit of building the airplane while we fly it to respond as quickly as possible to keep North Carolinians safe. But as I kind of think back through our response, it's really, to me, easy to see the department's priorities from before the pandemic woven throughout. Creating a healthcare system that buys health and promotes whole person wellness. Tackling the epidemic of an opioid use disorder where access issues and stigma has prevented historically marginalized groups from getting the care they need. And ensuring every North Carolinian has the opportunity to be healthy with the building blocks of food, housing, interpersonal safety, employment, and a healthy childhood. Just as much as this pandemic has created new problems, it has spotlighted the long-standing issues that were already there, and we intend to fix them. With that, I'll hand things back over to you, Mackenzie, to facilitate the question and answer session. Thank you.
Great. Thank you so much to Deputy Secretary Kinsley, and thank you to Professors Feldman, Ghysels, and Clark for sharing those insights. At this time, we are going to open things up for Q&A. So as a reminder, for those who may have joined late, if you are joining us via webinar, you're welcome to submit your questions now and at any time using the Q&A function at the bottom of your screen. If you've joined us by phone, you are welcome to email me your questions. My email address is mackenzie_bad@kenan-flagler.unc.edu. So we've got a few questions to get started with. Our first comes from Bo Mills. Dr. Feldman, you really focused on the role of states and how they have responded to the crisis. I'm interested in your thoughts about the role of cities and counties. It's my observation that cities and counties, both in North Carolina and around the country, were a step or two ahead in responding. Madison's observation about states being closer to the people might be extended to our local governments, even closer to the people, and acting faster in this case, perhaps logically so in urban areas. Maryann, do you want to take first stab at
Very good. Yes, thank you, Mackenzie. And so, Bo, thank you for your question. And I think you're absolutely right that there is a lot of heterogeneity in the responses of city and county governments. And that could be another panel. The cities and counties, in many cases, moved more quickly than the state governments, and you just expect it would take a longer time to get a consensus. The National League of Cities is collecting data on city responses, and I'm not sure about responses at the county level. And I do believe, Professor Clark mentioned how uncomfortable we are not being able to present multivariate analysis where we can make claims and about Kody. I think that academics are going to be studying this crisis and the responses and then the subsequent economic impacts for a very long time.
Excellent. Thank you, Maryann. A couple notes for those on the line. We've gotten a ton of questions from researchers, which is fantastic. And we're going to get to those as soon as we're able, but we will continue to give preference to reporters on the line. So for those who are interested in submitting questions, if you're a reporter, be sure you include your affiliation with your question so we can be sure to prioritize that. Next question does come from a researcher while our reporters get their questions ready. As states are dealing with budget shortfalls, is there talk of prioritizing projects or programs that would be specifically designed to stimulate the economy? For example, shovel-ready infrastructure projects or others. Are there any programs or projects that you think would be especially high impact for the economy?
Maybe I'll take a stab at this.
Yeah, please do.
I'd like to remind ourselves that we actually had an infrastructure bill that was talked about since the beginning of the Trump administration. It sort of stalled in Congress. But I think perhaps that conversation should restart, because it might be actually also a way to figure out ways for the federal government to help state and local governments. And I think most of those conversations on the infrastructure bill have taken place in various committees, both in the House and the Senate. And so I would think that that's probably the most likely shovel-ready sort of program that the federal government could restart or initiate or pass, that would actually have an immediate impact on state and local economies, and also would actually fix some of the deficiencies in our infrastructure that have been noted since quite a few years now. So I think this probably is the right time to have that conversation again, and it's probably the most obvious shovel-ready program that I can think of.
I'll add, if I may, that I think another opportunity here, and I kind of alluded to it in my remarks, is that obviously Medicaid expansion, right? We've done good analysis that expansion in North Carolina would bring upwards of 40,000 jobs into North Carolina, and at least from the federal influx of cash, it would be an additional $4 billion that is literally waiting there for us now. And so I think at this time, as we're truly trying to balance the budget, I think that being able to think about how the funding goes towards the safety net, towards, and the interconnectedness of healthcare, the fact that we see these costs show up in social safety systems, we see these costs show up in the prison system. And I think as I think about local government, right, a huge opportunity to reduce the expenses that local government faces by catching the ball of uncompensated care with Medicaid expansion right now. And so I also would think that that's another important conversation for us to be having.
And, let me go back to Madison once again. And so Madison says the operations of the federal government will be most extensive and important in times of war and danger. Those of the state governments are more important in times of peace and security. And unfortunately, state governments have really been drawn into immediately responding to this crisis and have not been able to engage in many forward-leaning actions and trying to affect, as Kody has said, this sort of addressing systematic problems that we note that COVID-19 has exposed, inequities in the system, in access to healthcare, in the low wage rates paid to essential workers and their unsafe working conditions. And so, states the federal system works really well when the actions of the states and the federal systems are aligned. Unfortunately, we have seen a lot of dissension as states have been bidding against one another for PPE and for essential supplies. And I think that now from this pause, we could imagine some restructuring and addressing some of these deficits. Interestingly, this is an election year. And so I think that we will see after this an ability to move forward on different dimensions. But there are, I think, a variety of infrastructure. And even we realize across North Carolina, teaching remotely to my students, how many of them did not have adequate internet. And as we move into this age where internet access becomes much more important, that would be an easy, critical thing for us to address.
Great, thank you all so much. Our next question comes from Dan Goldberg with Politico. States are opening up and also employing contact tracers. Do you expect people who can now make summer plans, BBQ, birthday parties, beaches, etc., to suddenly cancel those plans because someone from the government called and told them to stay home for 2 weeks? I'll open that up for the group.
I do think trying to say contact tracers really fast and not say contract tracers is really hard. We've been struggling with that a bit. I think what's important to remember is that contact tracing is not a new function. I mean, this is, frankly, is core to public health and had been in existence for hundreds of years as a strategy to get folks to isolate themselves. I believe that if we are capable to, and one thing that's worth mentioning is that when you look at the historical funding of North Carolina's public health infrastructure, we're fourth from the bottom relative to other states. And I think that is part of what we're rebuilding in our contact tracing infrastructure, is trying to reclaim ground from past underfunding. But if contact tracing works correctly, what it's able to do is, with more precision, identify the individuals that should not come to your barbecue, as opposed to you canceling your barbecue altogether, right? I think that we've had to cancel the barbecue for everyone as a quick way to try to get ahead of this pandemic. But hopefully, if we can get the testing capacity where it needs to be, with the support from the federal government that we need to be the bulk buyer and the mail clerk that we need them to be, and to get the contact tracing capacity in place, then we can more actively respond to folks and tell folks whether they should wait on that invitation.
Excellent. Thank you so much, Deputy Secretary. Our next question comes from Rebecca Martinez with WUNC. It's also for you, Deputy Secretary Kinsley. How do you see this COVID pandemic affecting healthcare coverage in the future? Do you think that North Carolina lawmakers will revisit Medicaid expansion or some other kind of healthcare expansion?
I hope so, and I think that I welcome the thoughts of my colleagues who have on the panel, who spent a lot of time thinking about this issue as well. And again, I think it goes back to that federalism conversation, right? We have an opportunity to do something that would relieve a lot of pressure off of our healthcare system, would relieve a lot of pressure off of local governments. And I think that taking that on, that federal resource, would be important for us to do. And I'll speak from, I spoke earlier from the kind of broader impacts right now on COVID, but I'll even speak from a behavioral health perspective. As of right now, we have already overspent the funding that we have for the behavioral health safety net by $16 million. I expect that number will hit $42 million by the end of June. And based off past disasters, we haven't even begun to see the increased need for our behavioral health services that we will see next state fiscal year. And so I'm talking about maybe $100 million more that we'll need just for the behavioral health services for the few people who get them that are uninsured. If we could bring half of those people into insurance, we could make better use of those resources somewhere else. So there's a lot of efficiency to be gained, and I hope that conversation happens.
So I'll chime in briefly here. So excellent question. And again, given my emphasis on identity politics and also teach a class on Southern politics, I'm more than happy to bring those things to bear in the answer to your question. So thank you, Deputy Secretary. So here's the thing. I just pulled up a map, okay, and it looks like of the states that have failed to expand Medicaid, about 7 of them are located in the American South, okay? So the South is different in a lot of ways. One of the main ways in which it's distinct is it's conservative ideology mixed with racial politics. So let me just make my point, since we're already at 11:50. My sense of Medicaid expansion, okay, is quite complicated. There's party, there's ideology, but there also was an African-American president that passed the Affordable Care Act that has been referred to as Obamacare. And if you tell people it's Obamacare, they're less supportive of it than if you tell them it's the Affordable Care Act. My point is this. The way in which I look at North Carolina and other states that have failed to expand Medicaid is, in one way, from a racial perspective, in that they see this as a government program that's welfare, that's going to bring in people who are going to receive healthcare coverage that they may not be as inclined to support. So again, I'm not speaking for everyone, and keep in mind I'm speaking from a very general perspective, but there has long been this link between racial politics and welfare and a social safety net. And I would be remiss to be on this panel and to not bring that up in this context.
Excellent. Thank you both for those thoughtful responses. That was great. Our next question comes from Corey Dean with The Well. This is a clarifying question back to you, Chris. You referenced budget legislation in your talk. Were you referencing special legislation like that in North Carolina that provided special funding for COVID responses, or were you talking about routine budget bills, or both? Just want to make sure she fully understands.
Yeah, no, excellent question. So I actually just went to the website, the National Conference of State Legislatures, and it's the state fiscal responses to coronavirus. And as I look at how they categorize it, they have supplemental appropriations are considered, and another category is rainy day and reserve fund transfers. So I think about this is distinct from other matters. So I hope that clarifies what I was talking about. And if you want, I mean, I have the link and I pass it along, and hopefully be able to get access to it as well.
Great, thank you so much. Our next question is back to you, Eric. What actions do you expect states to take to address budget shortfalls in both the short and the long term?
I think everybody is kind of waiting and seeing what the federal government is going to do. I think that's the first thing. I have noticed that notably the governor of Ohio has already started with some cuts in services. I think that's going to be, the cuts in services are going to be tough because a lot of the services such as healthcare, elderly, disabled, etc., these are not the times to cut those. So I do anticipate some cuts. If I had to put some money on this, I would say that most probably would think about tax increases one way or another, or fee increases. But I think the sort of the elephant in the room is still whether the federal government is first going to move on this, because $1 trillion is being proposed by the House. That's a huge amount of money that would provide a lot of relief to the states. I don't expect that the Senate will come along passing that bill, but I think most states are sort of waiting and seeing that some compromise will ultimately be voted on by both chambers. And once that is resolved, I think most states will then do the calculations for their own state and figure out what's the best way to deal with the budget shortfalls. So that's my guess on what will happen.
Great, thank you. This may be the last question we have time for, and it's one for Chris and for Eric. Seeing the debate that's starting to happen on a national level, if states don't receive more federal funding, what are their options?
Well, I mentioned that there is a balanced budget requirement for the majority of the states. So they will have to balance the books. There is, as I mentioned earlier, there's not very much wiggle room on healthcare and health for disabled and elderly. So the other items are going to be where potentially, unfortunately, cuts could happen is universities. Being an employee from the University of North Carolina, Chapel, I regret to say that, but we've seen that actually in the aftermath of the financial crisis, that a number of states had some very deep cuts to their state universities. And ultimately also, I think we will see tax increases one way or another at the state level. These are, I think, the ones that will feature prominently. And I don't think default is an option. Sorry this has been discussed, but if you look at the examples that we've seen, Detroit was extremely messy. I should also add, actually, that some states, notably Illinois, has written in the Constitution that, in the state constitution, that pension funding has to be respected. So there's not much room there, although a lot of states have serious employee pension fund liabilities, including Republican states. And so whether there are going to be cuts in that might be also a possibility, but in some cases, actually, it's not going to be easy to achieve that. And the primary example here is Illinois, where we take changing the state constitution. So I wanted to just add that as well. I forgot to mention the pension plans, which are actually huge in terms of financial burdens.
That's great. Thank you, Eric. Chris, did you want to add?
I just want to say, too, I agree with Eric about what he said about universities. And I also think, unfortunately, K through 12 also, I don't think they'll be exempt from that as well. I think I just saw a headline about Wake County. I didn't read it specifically, but I think they're trying to figure out what to do with their budget. But my point is this: I would expect K through 12 to be affected as well. And the other thing I think, and goes back to my point about the initiative process, I wouldn't be surprised if states that have ballot initiatives, you see, in the next couple of years, citizens saying, you know what, we're unhappy with what you've done. Maybe citizens don't really care as much about balanced budget rules as much as we might. And so they may make an effort to implement public policy nonetheless. But yeah, that's what I have to add.
Great. It's ironic that this is the time of greatest need. And so to see states having to cut programs at a time of this great need will only exacerbate, I think, what we're calling the dark winter, right? And the potential for a dark winter. And so, again, this idea that states could respond creatively and with initiatives that would increase the utility, the happiness of their local citizens, but they are so financially constrained that it's a sad day when we think that we're bailing out the airlines, but we're going to allow the Postal Service to go bankrupt. And we are also bailing out companies, yet saying that states and municipalities should be allowed to go bankrupt. I don't know what the Federalists would have to say about that outcome.
I just want to add on too, and I agree with everything that's been said. And I'm going to draw back. So in my last job, I was the chief operating officer and the chief financial officer for the U.S. Treasury, and was appointed to that role by President Obama, but was kept on in the current administration and served there for a little over a year. And I'm kind of running with something Eric said. I believe that we're seeing action in the House. I think threading in the fact that this is an election year, the fact that what Chris said, that we're going to see firefighters and school teachers and police officers potentially being laid off because of the spillover effects of this. I highly anticipate action from the federal government to shore up the state budget. I think what will matter is how we use those resources wisely, and whether that puts us on a footing for another recession of sorts, or if that puts us on a footing for a rebound that's unprecedented.
Great. Well, thank you so much to all of our panelists for those insights. Maryann, thanks especially for the look back at U.S. history. I feel like we need to do a rendition similar to Hamilton of Madison. That could be a fun thing for switching up our press briefings in the weeks to come. Thank you all so much for joining us here today. As a reminder for those who are our weekly attendees, we'll be taking next week off for Memorial Day. So we hope you have a good holiday and are able to get some much needed R&R. We'll be back with you in 2 weeks and hope to have you back with us then. Between now and then, if there are any resources I can connect you with, if you'd like to continue the conversation with any of our experts, please don't hesitate to reach out. You've got my email address, you've got my phone number, so reach out anytime and we will be most happy to help you. In the meantime, look forward to seeing you in a couple weeks, and until then, stay safe, take good care, and we'll talk with you soon.